Okay, first of all, thank you very much to the Polytechnic University of Munich for the invitation. And of course, thank you very much to Datacon Industry Association to be here. Okay, I like very much the discussion we have had before, because I will now talk about AMETIC, what is a national trade association, and also I will talk about digitalization of the healthcare system and also digitalization for the accessibility. Okay, so I will start my presentation. Okay, AMETIC, we are the voice of the digital industry in Spain. What is AMETIC? AMETIC is, as I said, is the national trade association in Spain. We have more than 300 members, and we are representing more than 10,000 companies. The digital industry in Spain employs more than 700,000 people and represent a turnover of more than 138,000 million euros. We are one of the oldest association of all kinds of association in Spain. We have 52 years old. And we are talking and we are discussing, you will see later on more details. We have 21 commission, but we are talking, we have companies from information technology, consultant companies, electronic industry, consumer electronics, digital content, telecommunication, thank you, telecommunication. But of course, and we are very proud of that, we have also research centers, we have university, technological part, and we have also not only, 10 years ago we have only offer industries, so let's say offer companies from the digital industry, but now we have also demand companies. For instance, we have Airbus that I've seen is also here. We have banks, for instance, the most important bank in Spain, Banco Santander or BBVA. We have also energy companies like Repsol, is member of AMETIC, and we have other companies on demand like also, for instance, Renfe, that is the railway company in Spain. Okay. What is a national trade association doing? What is the reason why we have this trade association? Because the national trade association is an ecosystem. So all the discussion we had before is very useful, because the thing we do together is to put in contact universities, academia, research centers, and the companies that are developing products and the companies that are demanding these products. We have the main objective for the association is to improve digitalization for the society, for the economy, for the society, and for the all people in general. Because we think, and it's okay, so I think we all agree that digitalization is not anymore a vertical sector, but is transversal to all kinds of business, but also impacting very much in the economy and in the way we behave and the way we communicate in the society today. Of course, it's the meeting point for the whole industry. And one of the things, because one of the biggest problems we have in Spain, if we talk about industry and companies, is the size of our companies. We have in Spain 99.9% of number of companies are small and medium enterprise. Okay, means nothing, but what has a real meaning is that 2/3 of the employment is created by a small and medium enterprise, and the same for the turnover. 2/3 of the turnover in Spain, or the incomes, is coming from the small and medium enterprise. And we need that these small and medium enterprises become big companies, because it's the way that the economy can develop and Spain can win in competitiveness. And for that, digitalization is key. We also promote integration of new companies in the digital sectors, startups, also helping scale-ups. And we are, one of the issues we have in Spain, but I think worldwide, is digital talent. It's one of the big issues we have. And also we see that from the European Union analysis, that the gross income is directly related to the expert in technology. So if you see a direct relationship between the percentage of people that is working as an expert in digitalization and the relation with the growth of the income in those countries. And of course, one of the things we are going to do as we are working in an ecosystem is that the big companies, because also you can see names like Microsoft, Google, Huawei, Samsung, Apple, Meta, all these companies are members of AMETIC, but we want that these big companies, global companies, also help the rest of the ecosystem to increase and to gain and to become more competitive in Spain. We are the digital, of course, the digital association in Spain, but we are collaborating with many other associations. One of the most important is COE. Maybe you know Business Europe. If you know Business Europe, COE is the Business Europe in Spain. It's all the verticals. For instance, Ametic is member of COE, but also ANFAC. ANFAC is the Association for Car Manufacturing, Construction, all kind of health associations. All kind of associations are in this confederation of associations. So this is the one that is talking to the government directly, is the one that is talking to the trade unions. FEPIME, and here we are member of the executive committee and also of the advisory board. FEPIME is for small and medium enterprise, and these two are for also, like COE, this national one, this is for Madrid, and this is for Catalonia. You know, this the big two regions in Spain is Madrid region and Catalonia and Barcelona. We are member also of Ultra High Definition Spain. We are member also of UNE, is the national standardization body in Spain. Maybe you know, of course, Gaia X, the European initiative for data spaces. We are member and we are in the advisory board of the Quantum Advisory in the Quantum Companies Association in Europe. And of course, talking about digitalization, we are a member of Digital Europe, that is the Ametic in Europe, the Digital Association for all associations. Atleti is very important because Spain is a bridge, we think, I hope you agree with me, we are a bridge between Europe and also Latin America because of the cultural heritage. So Atleti is a confederation of associations in Latin America and Spain and Portugal. And the last but not least, WITSA, that is the Worldwide Association for Digital Industries. So at the end, again, we're talking about ecosystem, but we have also a deep collaboration, of course, as our role with the government, with the Spanish government and with the European government. But also we have a strong collaboration with CDTI. The CDTI is the national office responsible for investment in research in the next, for the product to be developed in the next 3 to 5 years. So CDTI is the one responsible for investment in a new project that will see the light in the coming year. Red.S is for products that are already in the market and is for developing solution, smart city solution, healthcare. So investing in digitalization on all kinds of verticals. This is for digital talent and so on. So let's say this is the ecosystem. And we are also in Spain, and you are invited whenever you want to come. We have a few events, but big events developed by Ametic. This is of course with the Mobile World Congress, that we have special recognition of the most important professional in the industry. We have the most important Artificial Intelligence Summit in Spain. It's 2-day events, and we have all together the ecosystem, again, academia, industry, governments, everything. We have one of the verticals in Spain that is very important is tourism. You know that Spain is the #2 country in the world, I think after France, with the biggest number of tourism. This year we will reach more than 100 million visitors in Spain. For that reason, digitalization of tourism is very, very important, and we are also exporting digitalization of tourism to our country. Digital Industry Summit, that is a 3-day event. This year, for instance, we have 2 ministers, 4 Secretary of State, the president of big companies, of course, small and medium companies. We also give the award to the Barcelona Supercomputing Center, that maybe you know. Barcelona Supercomputing Center, for example, is one of the members of Ametic also, as an example. And last but not least, now in October we will do every year one specific for digital talent, because it's one of the key issues, and one is one of the big issues we have worldwide, and especially in Spain. Okay, and what is also Ametic is we are very proactive. So we are not here to complain and to say no, this is not working, but we are here to propose. So we are very propositive. We're proposing solutions, and we're proposing plans for the government. So many years ago, we will start working in the 4 verticals that we believe are the most important for Spain, because we are strong in this vertical. And with the support of the digitalization, we can make this vertical even stronger. So we were talking about digital health, that I will talk later on. Of course, tourism, I was explaining just before. Mobility, we are the number 8 worldwide production car manufacturing in the world, number 8. And of course, agri-food, that is also a very strong industry in Spain. So we were working on planning with different axes, a very big document. And when the recovery plan came after the COVID, the government took our documents and implemented. So we have a lot of, we get a lot of resources from the Europe for the recovery plan, and therefore now this plan that was developed before the COVID came, they are now becoming a reality, and this is making that Spain, in my opinion, is leading in the digitalization of health, tourism, mobility, and also in the agri-food. But today, okay, this is all the commissions we are working. So you can see Industry 4.0, electronic industry, innovation, very important commission, Agenda 2030, digital transformation, blockchains, artificial intelligence and big data, internationalization of the Spanish companies, circular economy and environment, cybersecurity, cloud, connectivity, consumer electronics, digital policy, digital talent, content, and public sectors, connected vehicle and mobility, treatment, signal treatment, smart cities, and the one of we are going to talk today, that is digital health. Okay? Okay, very short, we are more than 100 companies working in this commission. We are working in digital health strategy, communication, digital health skill for the different profiles in the digital health, and also in guidelines. The mission of the commission is very clear. It's first of all to see the best project and initiative and to spread them, to get to know not only to the private sector, but also to the public sector. One of the most important things we do in Ametic is the private and public and private collaboration. Also, very important, was mentioned before, one of the big issues in health is the data of the patient, because one of the key issues that is very difficult to have, and it's very difficult to, and without data, we don't have artificial intelligence, we don't have digitalization. We have already published, and we are working now, we have developed digital competencies of health professionals. It's very important because it's now, it's not only to have telecommunication engineer or engineers in AI, but we need that all kind of professional in the digital health, they have some digital skills. Some more expert skill, another one some more basic skill, but we need to have all. If we want to, one of the big roadblock we have in the digitalization is the people. We need to help them, to support them, to understand what is the benefit of the digitalization, and to give them the right digital skill to go on with their work. We are very proud because we are helping with the government with the national digital health strategy. As we, at the ecosystem, we are the expert in technology. The national system of health, they are the expert in health. And together we are developing the agenda and the strategy for digitalization of health. We are doing on the national level, and also we are doing on the regional level. Because Spain is similar to Germany in the sense that we have very strong regional governments, like Landmark, no, is in Germany. So they have, for instance, the health investment, also the education is transferred to the regional government. So for us, it's very important that the regional, and we have 17 regional government. So we have to work very closely to them. So we are supporting them on this digitalization. So here is a good example of the collaboration, public and public collaboration. Then, as I mentioned before, we have recovery and resilience funds for the EU Next Generation funds with the health of bankrupt health. We are working with the CDPI that I was mentioning before. We have also working on helping the industry to get the benefit from the profit, the benefit from the different plans for Europe and from Spanish national support plans. Gaia data spaces, and also working with another association. And here you have, of course, we're talking to the Ministry of Health, it's good because they have in Spain a General Secretary for Digital Health. So one person who works focused on digital health. Also we are working, of course, with the Secretary of State for Digitalization and AI, the regional governments, and all the stakeholders we have in there. Okay, and this is a lot of things there, but I think you are all familiar. You will be all familiar with this. This is for Spain, but I think this you can use in your country as well, or in your regions. First of all, one of the big issues we have in the health system, in the national health system, is the sustainability and the finance, because people, fortunately, aging people, we are getting older, and so we are living longer. Spain is the second country in the world after Japan with with an expectation of longer life. And this means that at the end of the day, of course, we're living longer, but we will have some, we're getting more chronic disease. That this means that we will saturate the healthcare system. That is a reality. So that is one hand. On the other hand, we have a problem. In case in Spain, especially shortage of health professional, we have some issues here. One is that some Spanish doctors and nurses are going away because they are earning more money in Germany, in UK, so we have a problem to retain the doctors we have, but also we have the effect of the baby boom. So in the next coming years, 25%, according to the data of some national health system, between 20 and 25% will retire. So we have not enough doctor. The new doctors are going abroad, and also the doctor we have today, they will retire in the coming year because of the effect of the baby boom. So this is especially a big problem, and if you go to rural areas, it's even more, because they have not enough people to afford to have a doctor for some population, some places. Okay, the challenge we have is, of course, modernization and digitalization. It's not an option. It's a need. It's a real need. I think if you see all the sectors in the world, I think the one that needs more digitalization is the health system. And we can see already many applications of AI at least in Spain, I think everywhere, how AI is helping the doctors. Because, for instance, if you go now to a doctor in Spain, I think the same in Europe, you don't see the doctor, because the doctor is behind a PC taking your data, but they should already have your data, because you make an appointment, and the appointment you are already, even if it's a private or it is a national insurance, the data, when you're making all the data, taking care of all this kind of information you give to them. But for instance, now we have in Spain an insurance company. They have their own hospital, and they're using AI. So when you go to the doctor, the AI system, what it's doing is first knowing who is speaking, if it's the doctor, if it is the patient, then is making the transcription of the conversation, and then is helping the doctor retrieving all the data concerning the information that the patient is telling. So if I have some pain, we're here. So then it's taking all the information that the system has, analysis and radio, whatever information they have, they're using that. So it's a way that, first of all, is make it more human relationship between the patient and the doctor. That is very important, especially for the patient, but also for the doctor. And on the other hand, it's more efficient. It's less time, and it's with all the data that the doctor can have. So this is one of the examples, but there are many examples that we are using now. For instance, one concerning research, Barcelona Supercomputing Center is working in the digital twin of the human body. So it is quite good to have exactly the twin of your heart, not the twin of a heart, but the twin of your heart in case you have some disease. So it could be very useful also for the treatment and for the prevention. And of course, one of the challenges, and we see also that I think young people are reducing smoking, obesity, and also alcohol consumption. So we see that this also is working. Opportunities. Digitalization of media records in Spain was a big problem, because as I said, we have 17 different regions. And then if you are in Madrid, and you are based in Madrid, there is no problem, but if you go to Malaga or you go to Barcelona, then in the past, they didn't have your record. Even they don't have your in the system, so you have to bring a special passport to be there. So now that is already solved, so now the doctor can have information of medical record. Telemedicine is of course a big challenge, and we are working here also with solution in high resolution, so that will not be only normal video, but also a high resolution video, so you can use a big screen, especially for elderly people, so they can interact with the TV. So not only with the PC, because some elderly people are not so familiar with PC, but they can also have the doctor on the TV. Of course, with data analytics is key, and we have data, you know, that's supporting also for the prediction and for the treatment. Artificial intelligence and machine learning, mobile health technology and wearables. In Spain, there was some project that, for instance, people with heart disease that have the doctor has the check with the smartwatches. Robotics, the famous Da Vinci, for instance. Also, early warning and for rapid detection in case that something is going wrong. Online collaboration and training platform. This is very important. Also, we have working in a project to make for the students in the university, in the medicine universities, to see in real time surgeries. But for that, you need first of all a high resolution video and high resolution, high speed also transmission. You have, and for that is key the improvement of IT infrastructure. If you see. This is amazing, and why we are focused and why I'm talking here today about healthcare. If you see a hospital, I think there is no other kind of building that has, apart from the data center, that has more data traffic and more important data traffic in the hospital. And the data traffic is increasing significantly. It's around 36%, even more, every year. And why is increasing? For instance, digital pathology, that is using gigabytes. Medical images, 3D and 4D, robotic cellular system. And also in the hospital, everything is connected. The professionals, of course, the doctors, they need to be connected. The patients also, but also you see in a hospital, you have also TV, streaming TV, for instance. And you have the people that is visiting the patient that also has they need the Wi-Fi for the devices, the equipment, the routes, the medical, everything, everything is connected, and telemedicine. So that is connecting the doctor with outside the hospital. So all this is data is increasing and increasing and increasing. And if you add here AI, this means that a lot of information has to go out of the hospital, and a lot of information has to come back from the hospital, from AI, from the cloud. So, okay, this is fine, this is great. The problem is here. The current infrastructure network we have in the hospital is a big bottleneck. Because if you don't have a very high-speed connectivity, all this is not possible. For instance, I was talking to a doctor in Spain, and he told me sometimes, in peak hours, he can take about 2 to 3 minutes when he's with the patient to download an X-ray. 2 to 3 minutes. Can you imagine 2 to 3 minutes waiting? What this does mean in a system that is collapsed already, that's already overbooking? So that is only for X-ray. Can you imagine digital pathology, telemedicine, the same? I mean, you cannot have a good relationship between doctor and patient if you are breaking down with the connectivity. So, so this is a big problem we have nowadays. We are now working on as a news from last week, for the first time in Spain, and now the government has asked the UNE, that is the standardization body in Spain, to develop a protocol, a standardization for gigabyte communication in the public buildings, because there was some standardization and regulation for the private buildings, but there was not any regulation for the communication within public buildings. So this is going to be very fast. It's planned to have by half of next year already developed a standard for gigabytes communication within the public building, especially hospital, we can imagine. And this means after this standard will be developed, then we will start with regulation, and that will be mandatory. So this is a big step, because without connectivity, nothing is possible. No new application, none of this will be possible. So 5 minutes. Okay, I'm checking you.
You're watching this.
Yeah, I just finished. Okay, This is about digital health. Okay, I think nothing new. I think you all are aware of this, but it's a big challenge. We are very proud because in Spain we are doing, especially from the national health system, the digitalization is very fast, and it's going very fast thanks to also to the European funds. So we are in a very good stage in digitalization of the whole health system. The problem is hospital with the infrastructure, but as I mentioned, the government is already working on that to have standardization and regulation. EVIA, what is EVIA? EVIA is an initiative from the Ministry of Science and Research, and with collaboration of Fundación 11 and America. America I already explained, so I will come back, don't worry. But Fundación is, I don't know if you know 11. 11 is amazing. It's a private organization, started like I think 60 years ago, for blind people. So at that time the government said, okay, we're going to give you money, but you can sell lottery. And from that lottery, that now become the third company in Spain in number of employment. So it's giving employment to more than 70,000 people in Spain, and 30% of them are disabled people. They're taking care of laundry, they're taking care of security, they're taking care of also the technology development. So that is 11 and Fundación 11. 11 is for blind people, and Fundación 11 Foundation, is for all kinds of disabilities. So this initiative started 16 years ago, so it's a long experience initiative, and it's important because, and also they say, when we are talking about disabled people, we don't expect charity. We expect that people that are developing technology and digitalization for disabled people earn money. Okay, it's a business, and you see, it's true. It's 10%. It's data for the nation. Around 10% of the population today, they have some disabilities. Sometimes because some problems, healthy problem, but also because of the aging. So if we live longer, sooner or later we have some problem hearing, also viewing, moving, also in the mobility. So 10% of the population has accessibility challenge. It's very important. So this is a huge market, big business. The mission of this EVIA is to promote research, innovation, to improve quality of life, for the social inclusion, also to improve the autonomy of the people. Okay, we have more than 648. We have 448 members, including companies of all sizes. And the thing that this EVIA, this platform, is doing is connecting digital companies with associations or companies that are working with disability, and merge. Then they see the challenge on disabled people, and also what the digitalization can do. And working together, we can develop solutions for disabled people. So this is an initiative, as I said, from the ministry and AMETIC together with Fundación 11. Very quickly, okay. So that's of course we are also helping these companies and this association to get the support from all the investment from the national programs, the European programs. Okay, social impact is clear. So,
perfect. Thank you very much.
Thank you.